Did you know that the success rate for hip replacement surgery is about 95%, which means most patients are reporting after the procedure their hip pain is significantly better and their overall function is much improved? However, with that high success rate, there are some instances that are rare, but patients do experience complications that affect their overall outcome and may even require revision surgery. Today, I'm going to discuss those specific post-op complications that some very few patients experience. Not only that, I'm going to talk about how to spot these complications and what specifically are you supposed to do in the event that one of these things occur. First off, a DVT or a deep vein thrombosis. So this is the red flag. This is the most important one that you have to look out for because something needs to be done immediately in terms of it's a medical emergency that needs to get taken care of very quickly. The response has to be fast. So if we're suspecting a DVT, the scary part, the part that will be the biggest concern is if this DVT becomes dislodged and enters your bloodstream, your circulatory system, and enters your lungs, which results in a pulmonary embolism or a PE. So how do we spot a DVT in the first place after hip replacement surgery? So really the main place we're looking for is the calf of the surgical leg. So if you had surgery on your right hip, you want to look out for the right calf. Now, what you're going to notice if there's a possible DVT, one, that right leg, you're going to have increased swelling, much significantly more than your left. Obviously, the non-surgical side is going to primarily have no swelling, but there's going to be a significant difference in size. So that's one thing. You're going to notice a little bit more swelling. Two, there's going to be a lot of pain in that calf. So it's going to be very, very tender to the touch, especially if you stand up and in weight bearing, there will be increased pain. It'll be throbbing. And if you try to touch it with your hand, it will also be very uncomfortable in a standing position. But even just changing your position from sitting down to standing, and now you're weight bearing, that calf is going to be more uncomfortable. Additionally, that calf may be a little bit warmer in terms of temperature to the touch. So we want to be looking out for DVTs where we're looking at swelling, we're looking at pain and tenderness at the calf, we're looking at increased temperature of the skin of the calf. So those are the things that you want to watch out for so we can respond very early in response to a possible DVT before it possibly develops into a PE, a pulmonary embolism. Now, with any type of surgical intervention or procedure, such as total hip replacements, we're always on the lookout for signs of infection. So if that skin around this incision is a little bit more red than normal or what it has been after the procedure, we're looking out for that. We're also watching out for the temperature. So if that skin around the incision is much warmer than other places of the body, that's something that is a little alarming and we just want to be aware of it. Additionally, if there's any abnormal leaky discharge or pus that isn't associated with typical skin healing or wound healing, such as when you have that dark redness when you are scabbing and the skin is coming together, if you have that abnormal leakage or pus, that's also a sign of infection. And having just a fever in general, so that infection can become a little more systemic in the body. So recognizing the signs of infection and being able to get the appropriate medical response. So typically they'll intervene with some sort of antibiotic to get the infection under control and taken care of. So that's typically an easy one that is very, very treatable after the procedure, but being able to recognize the signs and symptoms very quickly is going to help the recovery much faster. The last post-op complication is the dislocation of the new hip itself. So this is the one you hear horror stories about where people say, oh, if you move the wrong way, that hip is going to pop out. Or when people are far along surgery and they make jokes of, oh, I don't want to pop my new hip out. This after surgery is a real thing, and this is a incident that can happen, but is very, very preventable so long as you know the movements and positions that you must avoid for your specific type of surgery. Now, with the hip replacements, there's different approaches that surgeons will use depending on the specific patient. So the two most general ones are an anterior approach and a posterior approach. So essentially, with these different types of styles or approaches of surgery, all that is referring to is where in relation to your body that they are going through in terms of the incision, where are they cutting through. So if it's an anterior approach, that anterior means the front portion of your body. That means they're gonna do the incision and the surgery going through the front of your hip. A posterior approach is through the backside. They're going through your butt muscles, so your glutes, on that backside of your hip. So with those styles of approaches, you want to be aware of what you can and cannot do. So with the precautions after surgery, every surgeon is going to have a slightly different precaution of what they specifically want you to do and what they want you to avoid. So you want to make sure you pay attention and you confirm with the surgeon, with the physician assistant, all of those precautions so that you're aware of what movement, what positions are safe for you. Now, in general, I'm going to give the most common post-op precautions that a lot of surgeons abide by and typically guide their patients to do in terms of what's best practice. So for anterior approach with the hip replacement, in general, the main movement / position you want to avoid if they went through the front part of your hip is you do not want to let that surgical leg kick behind your body, especially with the toes pointed out. So again, let's say if you're standing with your legs even, your feet side by side, if you had surgery on your right side, for example, you do not want to kick your leg, your surgical leg, behind your body, especially with the toes out. So what that's going to especially do is put stretch on the front of your hip, and it'll be the most vulnerable position for that ball and socket to possibly pop out going forward. So anteriorly, if you had the anterior approach. Now it's reversed in terms of the posterior approach. So if you had a posterior approach where the incision is on your backside, it's on essentially like the butt muscles. If they went that way, you want to avoid excessive bending forward. So a lot of times as we try to stand up, we'll bend forward. So your hips, if the more they bend, the more likely someone is to dislocate that hip and put a lot of stretch on those soft tissues on the backside of their hip. So you want to make sure that you're not doing any excessive bending. So the main rule for a lot of posterior approach is no bending the hip past 90 degrees. So if you're sitting in a typical chair, your torso and then your thigh, that angle of your hip, so from your torso to your thigh, you want to make sure you never bend past 90 degrees if you had that posterior approach. So if you were to bend past 90, that would look like bringing the trunk forward, and now that angle is going to go much past 90 degrees. So you want to make sure you're avoiding any excessive bending with that posterior approach.